Yes, you can. Yes, yes, thank you.
Okay.
It's okay.
Good morning and good afternoon for everybody. I know it's now a little bit late for all of you. I have seen you a little bit tired. I wanted to make it a little bit energetic. So thank you. First of all, I want to give my thanks for all the people, for all the staff and the organization. Thank you very much. I'm very glad to be here in Morocco, in Casablanca. This is for me the first time. Thank you very much for your welcoming and your hospitality for Renalia as well. I am Dr. Iman Saba from Spain. I raised and studied there in Spain, so I will talk with you in English, and I will talk with you in Arabic. I speak very good Arabic, but sometimes I have to speak in English as well. So, أهلا فيكم جميعا. And first of all, عايزة أتكلم وأقول لكم إنه نحن هنا في عصر like this more yes. Where's the camera? This one here? Okay. Okay. نحن هنا في عصر جديد في البايوستيموليشن سكين بايوستيموليشن. جميعنا نعرف أهمية الفايبروبلاست وأهمية الكولاجين كأعمدة أساسية في بناء البشرة. IT فارما تقتحم الميديسين استيتيك في تعريف جديد وفي مبدأ جديد، وهو مبدأ الويل ايجينج ومبدأ الكونسبت بما نسميه تعريف امبيوتيك عنبر. امبيوتيك عنبر لن يتوقف فقط في البايوستيموليشن للجلد، ولكن له أبعاد أخرى وآفاق أخرى. سوف يدخل في البيولوجي داخل البشرة، في داخل الخلايا، ويجدد هذه الخلايا. سوف يكون مثل الموتور أو مثل الإنجين الداخلي الذي يحدث في هذه الخلايا. تسمعوني جيد؟ تسمعوني جيد؟ أوكي. فسوف يدخل في هذه الخلايا وسوف يعطينا هذه الطاقة التي نفقدها مع مرور الزمن ومع الايجينج عفوا. فأمبيوتيك أمبر لن يتوقف فقط في البايوستيموليشن، ولكنه سوف يعطينا أيضا an anti-inflammatory, anti-oxidant, skin rejuvenation، وسوف يفتح لنا مجال كبير جدا، وسوف تكون من أحسن الآلات التي سوف نستخدمها في our center، في our medical center. في اليوم مثلا بنشوف كيف الاي تي فارما دخلت في عالم انترناشونال كبير جدا داخل الامبيوتيك عنبر، وهو مركب من الهايلورونيك اسيد. It's not reticulated, it have a high weight, and يدخل معه ايضا السكشنيك اسيد اللي هو ما نلقيه بكلمه العنبر. سوف أتكلم عن المزيد من المعلومات يوم السبت إن شاء الله في الكثير. الآن عندنا تقريبا 20 دقيقة لأتكلم معكم عن الأس تكنيك وعن ما سوف نراه في هذه الأس تكنيك. I perform this technique and I call it S to remember me as Saba, but at the same time بدي أورجيكم إنه حرف الأس بيدرس نوع من التوبوغرافي في داخل الوجه، في different thickness و different كثافة ما بين كثافة الجلد في البشرة اللي هي الديرمو and subcutaneous tissues. فحسب توزيع هذه الشغلات سوف تكون مختلفة، وسوف نوزع الدوسج تبع العنبر بشكل مختلف، لأننا لا نحتاج أن نضع كميات كبيرة في جميع الجلد. فسوف أريكم كيف سوف نعمل هذه العملية. اوكي، فدعنا uno de estos. امبيوتيك امبر رح يفتح لنا مجال جديد. نحن هلا مع our patient اسمك ويام. She told me today that she has some pigmentation, and this is very good for our treatment as well. بالرغم انه سكين بايوستيموليشن بس له عامل هام جدا في يحسن من البيجمنتيشن للبشره، وهذا رح احكي لكم اياه يوم السبت لانه it acts directly on the tyrosinase وحيعمل inhibits وحيعمل blocking في كل كيف رح يطلع منا الدوبامين ولا الميلانين، فحيوقف هذا وحيساعدنا كثير في البشره. نحن بنعرف انه في الطب عندنا we use a lot of devices, and these devices, as much as we use, we will have a problem in a post-pigmentary inflammation. So we will keep our devices and we will make this now. So first of all, I want to tell you, dame un lápiz blanco, por favor. Okay. So first of all, my technique, we call it an S technique. Why I make this technique? First of all, I want to show you that if I make here a distribution, we have here this T. This T has a very low thickness of dermal and subcutaneous tissue that will be between 0 and 3 mm, which is very low. We don't have to put here a lot of injection of our hyaluronic acid and amber, but in these places we have another topography. We will have it from 3 to 6 mm of the thickness, but all the biggest one, the biggest side of thickness will be just in the middle phase. So I will put my most dosage to make a very synergical treatment in this area. I will put my most doses in 5 points, 1, 2, 3, and 4, 5. Just remember, we will have 5 points, and I will distribute the other points in the face. I will put here, we have our where's the syringe? Mm-hmm. Our syringe, we have 2 ml, so I will divide 1 ml here and the other ml on the other face. I will put my maximum dosage here with 0.7 in the mid face. Why? In order إني أعطي volume وأعطي نشاط, and I will go for all this depletion. I will improve, هحسن البيجمنتيشن، رح أحسن السكين لاينز اللي بتكون تحت العين من غير داعي إني أعمل a lot of function in this area. So I will put here 5 points. I will go for 0.2, 0.2, 0.1, and I will make another line as adjacent line, to interact between them to give a very good fibroblast and a very good elastin in order to make a mini lift and to make a volume here. And of course, and to have all the antioxidant, all the anti-pigmentation in this zone. And then I will put here 1, 2, 3, 4, and 5. And this is my S technique. I don't know if you can see it. Yes? Okay. How we are going with time? Good? Good? Oh, this is very good. We still have. Okay. I like to. Can you open this please for me? We will make we can make an injection in mesotherapy, and we can make an avanique, but with my technique, it's like a mesotherapy mechanism. So we will put it in intradermal, and you know the subcutaneous, it's very attached, really. You can separate the subcutaneous from the dermal. So I'll be there without doing a papule, because I want my patient, when she go out of the clinic, she feel fine. She doesn't have to have a big papules. Are you fine? You're afraid? Little bit? Yeah. Okay. Don't be afraid. So I only want to show you here, where is the S? because maybe you lost the S, you don't know where's it. So here I have my S again to remember. 1, 2, 3, 4, 5 points with 0.7, 1, 2, 3, 4, and 5. And here we go. Okay. We are going to put here 0.2. In our syringe, we have a very good dosification with 0.1, 0.05. 0.2 and 0.1. So I have here now like 0.05. I will put another 0.1 and another 0.1. So I have less now 0.3 to finish my 1 ml. I will give here just 0.05. I don't have to make a big papilla here, as I told you that we don't have a lot of thickness. I will put 0.5. 0.1 will go this to make an action to lift this zone, and all other this point it will go only for 0.05. So we're going to put here 0.05, 0.05, and give my last one in 0.05. So now I just finished the half of it. How do you feel? I want to tell you that our patient will find in this moment, she will find something different, okay? And I always tell my patient to touch this zone. I tell them إنه بنترك لهم جوا زي كأنه some papilla, interior papilla, and it will go in like 6 hours. They can be 10 kilos, مرتاحين, okay? And now we are going for the next one, okay? On Saturday, if you want, we can make the abanique, and we can combine with abanique and with the papilla with my technique. Thank you very much. Okay. I still have 5 minutes, okay? So we are going here, and we are going to repeat. This technique is an easy technique. The patient will be very happy. She will start to find a very good improvement in pigmentation and anti-inflammatory. She will have, as you can hear, you see here, she has a scars of acne. So this treatment is very good as an anti-inflammatory, and I will talk about it, why it's an anti-inflammatory. It has a very good results. We are going into an intradermical. I will put here 0.2, because what I want to do is to create a volume will increase the number of fibroblasts and the activity of the fibroblast. Zero 0.1 and 0.1. And I have now less 0.3. So I'll give here 0.05. This is the only point. We'll go for 0.1. Zero 0.05, 0.05, and this is my last point. How is it? Waja? I don't know if you can notice just right now, she will have a radiance skin. Ambiotic amber has a very good result because as well it's an angiogenic treatment. I will talk about all of these on Saturday, of all the properties of ambiotic amber. And that's it. Thank you. I wish it wasn't so much. Wait a minute.
Thank you. Thank you, Dr. Saba.
I want to tell you something.
Okay.
Most of them, I'm sorry, I want to tell you something. Sometimes I tell my patient to just touch this zone because they will find something as we call a bottom يعني مثل يكون في زر كأنه في زر داخلي وهذا الزر. I tell them that I want to leave this solution, amber solution in the skin to make and to restore. I will talk a lot about it on Saturday. I'm very excited to tell you about amber. It has a lot of properties that you will really like it. You don't have to make so much massage. She will touch it as well. She has to be tranquila, and she will be very good in these days. She will find a very good results, and after 10 days, a brightness. إحنا بنسميها في إسبانيا والآن في جميع دول العالم، في الأرجنتين، في هونغ كونغ، في أوروبا. نحن بنستخدم إبرة العنبر وبنسميها بالفعل إبرة النضارة لجميع من يعني الدكاترة اللي شافوها والpatient and everybody. I hope you will like it. Thank you.
Thank you, Dr. Iman. Saba, for sharing your experience. If there is some question.
Do we have any questions from the audience? Oh, there's one, yes.
I'm sorry.
Is it necessary to put the points of the injection in the same place that the doctor put it there, or we can just place it all over the face with papules? Thank you.
I can't listen. I don't. Okay. Okay. Where's the question? Where is it? Yes, thank you very much. You can put, wherever you put ambiotic amber, you will find a very good results. You can make it in a mesotherapy, in Avanique, everywhere. Once you have, I will talk about it on Saturday, when you have some pigmentation in our skin and you want to distribute the dosage, you can put it here as a mesotherapy. Perfect, you can do it perfect. This technique is very good for all our patients, for young skin and for adult skin, because you have to know something, that the ambiotic amber, when you put it, you have a restoration inside. It will work alone. It will work. So if you want to increase the dosage, you can do it perfectly. If you want, I can show you on Saturday, inshallah, how we can make it on mesotherapy. Okay?
Okay, we can take one more question. Okay. How many sessions do you recommend?
Okay, I recommend we make a roll of 3 sessions, each month. Sometimes we started to do it after 3 weeks, really, in my experience. But a patient, they love it after 2 and 3 weeks. Everybody that I make for them إبرة العنبر, they want to repeat it. They come to repeat it. بالفعل هي إبرة النضارة, and we will talk about the restoration. It has a lot of properties. So I always make, because instead to make it after 3 weeks, I would make 3 sessions monthly. And of course, you have to put and to think about the age of the patient. It's not the same to make it on 25 or 30 years old to make a decision with a 50 years skin aging, okay? But of course, I would rather do with 3 sessions.
Thank you very much. I think now we have the lunch break, or
Okay.
it's not?
Thank you very much.
Okay.
Je vais lui dire, elle va te répondre. Alors, nous remercions la société Renalia. Je remercie beaucoup Monsieur Talal, qui est très impliqué dans la formation continue. Et là, ils vous ont présenté l'Anbar. C'est un produit qui est nouveau au Maroc. Et donc, vous connaissez tous Renalia. Et donc, je vous laisse après discuter avec lui. Il a un stand ici. Ce que je voulais vous dire, c'est que le prochain workshop n'aura pas lieu. Il était prévu qu'il soit fait par Obagi, par le docteur Obagi elle-même. Avec son père, ils sont les inventeurs du produit. Elle n'a pas pu venir pour des raisons personnelles, mais Inch'Allah, on aura l'occasion de... ça devait être présenté par la société Skin Edge. Donc les peelings, l'association des peelings, ça ne sera pas fait. Elle n'a pas pu venir à la dernière minute. Donc Obagi, ce sont les inventeurs de Ozoskin, etc. Ils ont écrit Ozoskin by Obagi. Maintenant, Obagi ont repris leurs produits, donc c'est Obagi. Donc le déjeuner pour aujourd'hui, c'est des lunchbox que vous allez prendre et vous allez regagner la salle de manière à ce qu'on gagne du temps, parce que nous avons, bon, on a gagné les 20 minutes de Obagi, mais là, il va falloir reprendre pour gagner un petit peu plus de temps.